when she came in, I noticed that right away, and she was like, I want lip fillers. I'm like, you know what? Why don't we can do lip fillers, but let's try to minimize the scars. Like, I'm not doing anything to make the scar smaller, but I'm working with her lips.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Thuan Phan, a board-certified nurse practitioner with more than 16 years of medical experience and founder of Vital Aesthetics in Issaquah, Washington. She blends science, artistry, and safety to provide personalized, non-invasive treatments designed to empower clients. At her clinic, the focus is on each individual's unique needs, recognizing how appearance influences overall well-being. Vital Aesthetics offers both preventative and corrective options to help clients achieve a refreshed, youthful look that enhances their natural beauty. So Thuan, welcome and glad to have you here.
Thank you, Daniel.
Yes, let's dive right into it. How did you first get interested in medicine?
When I was in my early 20s, I took an anatomy and physiology class, and I fell in love with the class, and I went to school to become a nurse. I just thought the human body is so fascinating, and one thing led to another, and here I am today.
Okay. So how did you make that transition over to aesthetics?
So I moved to Washington maybe about 6 years ago, and I have always liked aesthetics, but I never ventured into it. I had a pretty cush job as a nurse practitioner back in Colorado, and I did take a aesthetic course down in Dallas at the time, but I had such a great job that it wasn't something that I was adamant to pursue. But then once I moved out to Washington, starting all over, and I had my 3-year-old daughter, and I wanted something with flexibility, so I got a job at a local med spa, and I worked 1 or 2 days a week, and then COVID happened, and then I ended up opening up my own business during COVID.
Oh, wow.
Yeah,
Talk about timing.
yeah, yeah.
Not in the end, obviously. So I'm curious, when it comes to your practice, what would you say is the most common treatments that your clients come to you for?
So the common treatments my clients come here for, and probably the same as any other med spas, would be the neurotoxins. That's kind of what gets people in the door, and that's the most well-known treatment. But the second treatment that we offer that a lot of our clients like is radiofrequency microneedling. A lot of our clients really are kind of getting away from like fillers and stuff, and they want to start doing more preventative stuff. And with RF microneedling, that's one of those things you want to have someone that's very knowledgeable in energy devices to treat you, because you could potentially have some bad adverse outcomes. So a lot of our clients like it. We get really good outcomes. It's a good kind of preventative anti-aging treatment. But the neurotoxins would be what gets people the door initially.
Okay. So would you say then that the microneedling is more in the camp of preventative, anti-aging, and the injectable side is more for kind of like once you already have it, you're trying to just smooth things out or plump things up, not so much preventative.
Yeah, so I would say RF microneedling definitely preventative. The neurotoxins can go either way. Now it's different now than when I was younger. It was such a taboo when I was younger. So people didn't really get like Botox or Dysport or any of those neuromodulators until later in life. And now, with the different generation and everything, they're doing it earlier in their life as a preventative versus doing it too late as a corrective.
I see.
So yeah, so it goes both ways, but I feel like the younger generations are really good about preventative care, not just with neurotoxins, but like, drinking less, drinking more water, eating healthier, and all that contributes to aging better also.
Got it. Now, with the microneedling, what exactly is microneedling and how does it work? I think when people think about injectables, they understand just you have a syringe, you inject. With micro,
Mhm.
exactly how does it work on the skin?
So, microneedling, there's two different types of microneedling. And the one I was discussing earlier, it's called radiofrequency microneedling. So that is an energy device. And what happens is there's different types of needles, but it's pretty much kind of stamping on the face. You get energy pushed through the needles in heat form, and it causes micro injuries on a deeper level, which pulls the skin together. And it also helps retexturize the skin and also improve pigmentation that way. So when you're pulling the skin together, you're improving elasticity. So I have a lot of clients in their 40s, 50s, where they notice that they have more sagging skin. They're losing more collagen with age. You have, women, we go through all these phases of life and, we're premenopausal, perimenopausal, like all that stuff contributes to the aging process. And a lot of my clients, they tell me all the time, I'm turning 40, and I just realized, my face is falling apart. And it is a very common complaint. And it's because, we're going through all these hormonal changes, and it affects how much collagen we're losing on a daily basis. And so with the RF microneedling, what it does, it helps kind of tighten up some of the skin and help kind of lift the skin a little bit through tightening. So in that sense, it does kind of help prevent the skin from sagging um, any worse than they are.
Okay, got it. So that's the radio frequency microneedling. Is it just a regular microneedling that's not radio frequency?
So the regular one doesn't require energy. There's no heat involved in that. The radio frequency involves, the radio frequency part, the heat energy in that, which kind of burns underneath a little bit. And then the skin itself, the body itself heals it. And when it does, it pulls the skin together. And it also contributes to collagen building. So you're getting some natural volume that way, and you're getting skin tightening that way also. I mean, there with some of my clients, I do melt some fat depending on how deep I want to go. But there's only certain areas that I want to target fat, and some areas I don't want to target fat. I just want to do skin tightening. And this is why it is important to go to someone who is very knowledgeable,
Mhm.
has really good training, and focuses on education to deliver the best results.
Got it. And so between the radio frequency and the regular one, what would you say is like the main differences between the two? Or is it going to be use one in a certain situation or a certain type of skin and the other one a different situation?
So if you're looking to really like retexturize the skin and not too much collagen building and skin tightening, then the regular microneedling would be ideal. But if you're looking to help improve the skin tightening aspect of it, to improve collagen building, then you want something that's going to be penetrating a little bit deeper.
Okay. But both of them really are to help with anti-aging or I guess with slowing the aging process.
Well, everything we do tries to slow down the aging process, even like with peptide injections and stuff like that. Because, everybody, they don't mind the aging, they just don't want what comes with it,
Uh,
right?
yeah.
Right. And so they both are good when they're used appropriately. So you can actually do the RF microneedling and then microneedle on top of it, because the
Oh,
regular microneedling is more surface, even though it can go a little bit deeper, but a lot of times it's more surface work, whereas the RF microneedling tends to be a little bit deeper.
got it. Okay. And then I'm assuming microneedling can also work in tandem with the injectables, the neurotoxins, the fillers, the Botox, all those ones. Can they or
Yes, so they can. I don't believe, and I could be wrong, there's no real research that says you shouldn't tox or inject fillers after you RF microneedle. I mean, you wouldn't want to do it before, but you could do it after. However, a lot of the companies don't recommend doing it on the same visit. So it's all client and treatment selection for me. Because if I'm doing something that involves a lot of energy and deeper penetration, then I may hold off on any deeper injections. But if I'm going a little bit more superficial, then I would do some of those injections. So it's not cookie cutter for everybody.
Okay. So then what would be some of the most common misconceptions you hear when it comes to microneedling or myths about microneedling?
Sure. So it's not really misconception or myth because it is true. The big thing with RF microneedling is that you are melting fat and you're losing support. So people are kind of more sagging
Mm.
because there's areas in your face that have fat pads, and this is where the provider is important. Because if you're not setting it at the appropriate setting, you're not setting the needle depth at the appropriate depth for whatever you're trying to achieve, then you could essentially cause some adverse outcome. There are people who have had unfavorable results due to like losing fat in certain areas where they shouldn't have in the first place. So again, at the end of the day, these devices are great when they're in the right hands, but they could be bad if you have somebody that's just doing it because they think it's a moneymaker and they're not taking the appropriate courses, training to provide that service.
Got it. Now, this is, I think, a tough thing that regular people have to deal with. Like, how do you find the right provider, like you mentioned, like the one that really knows what they're doing? So, if someone's looking to try and find that right provider that is knowledgeable, is very skilled, like they have a good rapport with, what's the
Mhm.
most important piece of advice you would give to that person on how they can find that ideal provider for them?
So, asking questions is really important. You want to, when you go to any new place, you want to check their credentials. You want to ask them how long they've been doing it, see before and after results, read reviews. And I think, at the end of the day, it's your choice who you trust and everything, but building up that trust and that rapport with somebody is important before you leap in and doing something that kind of, as extreme is not the right word, but invasive, right?
Mm-hmm.
Yeah. So, and then, if you have friends that like a certain provider, you can always ask for recommendations. But at the end of the day, it's your choice. So you want to ask all the right questions and feel comfortable in their hands.
Okay, great advice.
Mhm.
You did talk about peptides. What is peptides and what's really the benefits of peptides?
So I don't offer peptides at this point, but the trajectory of aesthetic medicine is definitely going that route.
Mhm.
So maybe we can save that for another day because I don't want to give you answers to things I really don't know too much about. Yeah,
I think
so
that that's actually a good segue because as far as where do you think the future of aesthetics is going?
it is definitely going towards preventative. It's going towards hormones. It's going towards more natural treatments. I mean, fillers and stuff always has its place. I mean, your body makes hyaluronic acid naturally, but we're as we men and women, we're losing volume and stuff. And so everything has its place, right?
Mhm.
But now that there's just more education and there's more studies and research that shows like, you know what? There's the GLP-1s help with aging, peptides help with aging, hormone replacements help with aging, like all this stuff, um, just identifying what you need can help you age better, right? And then reducing your stress, like just like a combination of everything, because we all know someone who has a higher level of stress, if they're a smoker, if they don't eat well and all that stuff, they're gonna look like they're aging so much faster than somebody that, exercises more often, drinks a lot of water, eating a little bit healthier. And then again, genetics plays a big role in all this too.
Mm. Okay. So do you think that wellness is really going to be kind of what a lot of aesthetic practices morph into, I guess you can say?
It is definitely going that route because I am starting to offer hormone replacements also. A lot of my clients are in a certain age group where we are noticing changes within ourselves. And I have this conversation all the time because, they're coming in, they're talking about their face. And
Mhm.
then that leads to hormones, right? Because a lot of people don't realize that they are going through all these changes. We talk about things we've noticed about ourselves. As a female, we get labeled with having too much stress, having too much anxiety, being, the B word, just things like that. But really, internally, our hormones are changing because we are aging, right? And we lose more collagen with age, we lose more fat support, we lose our muscle tone decreases. So, 10 years ago, I wouldn't jowl. Now I'm jowling, right? Meaning like all that's coming down. Our muscle is starting to deflate, it's starting to descend and all that stuff. So all that's part of aging because our body structure, all that stuff is changing. If you sleep on one side, repetitively, you're going to lose more volume on that side. If this side is exposed to the sun's, more than this side, you're going to notice more of a change on this side. So all that stuff throughout the years is going to cause subtle changes that you don't really notice because you look at yourself every day in the mirror, right? But when you go to someone who is trained to look at the face and all that stuff and kind of identify symmetry and asymmetry. They're going to point out things that you're going to be like, oh, I never noticed that. You're right. I do sleep on this side. I never noticed that this cheek is wider than this cheek. Or, oh, I never noticed that my chin is kind of shifted slightly, maybe 1 or 2 millimeter to the left or the right, like things like this. So, yes, I just feel like everything just comes together. And yeah.
Okay, so with the hormones then, you mentioned it's as people get older that's when it starts to become more important to look into it. But at what point should people really start looking at some type of hormone treatment or hormone replacement therapy? Because I don't think people wake up in the morning, it's like, oh, I feel like my hormones are off today.
Yeah.
They just don't
So,
know.
no, so it's not people getting older. It's just my clientele that mention it to me happens to be usually their late 30s and 40s. I feel like just hindsight looking back as females and maybe males too, we should start looking at our hormones in our early because there's so many stages
Mhm.
to this because there's premenopausal, perimenopausal, menopausal, and postmenopausal. And however long anybody stays in each stage varies. There's no studies that says if you're going to be in your premenopausal stage for 5 years, you're going to be in your postmenopausal stage for five. Like, there's nothing that's going to tell you how long you're going to be in it, right? It's just you kind of base it off of lab work, symptoms, and things like that.
Okay.
Yeah.
So
But you're gonna go ahead.
you should just get tested like kind of no
They're
matter.
not gonna they're not gonna test you. If you go to a medical doctor, they're not gonna test you for those things because your labs are gonna most likely be normal, but your symptoms change.
Mm,
Okay. So even for men, they go through it. It's called andropause, whereas women, it's menopause. But we have all these symptoms that change as we age, such as stress, anxiety, brain fog, memory changes, like just things like that, where I know when I was younger, I was like, oh, I'm overexerting myself. Oh, I'm not getting enough sleep. Oh, I have so much in my mind. Like I'm forgetting things because I'm thinking too much or whatever. And the reality is, I'm just changing inside because that's part of the whole aging process. And just to be able to identify, like, you know what, it's really not me being anxious, it's my hormones are changing, right? And that's just how my body is reacting to it.
okay. So then how would somebody know what to do? Like they're thinking that, okay, should I just try and see, do I need hormones or I'm not feeling my best, so I should go get it checked? Or even if they're feeling okay, like should they still
Mhm.
find a way to see can hormone therapy help them?
I feel like if it is starting to be disruptive, in their day-to-day life, if they are just a little bit more anxious or they're constantly forgetting where their keys are at or like for me it was like I know what that word is, I just cannot remember, it's just at the tip of my tongue, like things like that where I'm like, you know what, I think there's something going on, so I need to go see somebody. I don't think it's like, hey, I'm 30, I should go see a functional medicine doctor or a naturopath or anything like that. I think when anything starts to become disruptive in your day-to-day living, then, a green light should come on and say, like, this is not me. I am not like this. Maybe I should go talk to somebody and, see if this is something I may need some replacement in. And
Mm.
it's okay to, and it's okay, there's, we're all changing and it's not a bad thing.
Now, with women, I'm assuming that the hormones that they may be lacking would be estrogen. For men, I'm assuming it's testosterone. Is that the case? Is it so cut and dried, or is there more nuance to it than that?
There's more nuance. So we all know women have estrogen and men has testosterone. And that's what our mind tells us. But there's a whole background to it. So there's always thyroid. There's also uh, DHEA, which your body makes. There's a whole complex workup for it. So, but for the general public, we just think women have estrogen, men has testosterone, estrogen, testosterone, and that's what we need. But really, it's not that. A lot of the stuff your body makes naturally, and it's slowly depleting it. We just have to kind of replenish it according to our symptoms and what we need and how we feel. So there's just not those two hormones that need replaced. There's still like a few others that need to be addressed.
Got it. Okay. Now, Tuan, I'm curious, when it comes to artistry or creativity, how important do you think that is in what you do and how you approach your patient care?
Oh, it's very important. So people can differentiate a good provider, a good injector and stuff from someone who is just showing up to work. Because when I look at anyone and when I look at you, I look at you as a whole. If let's say you came in, you want lip injections, I look at you as a whole and not just your lips. And that's where creativity, artistry, all that comes in. Because if you already have big lips, then I'm going to tell you, like, you know what, let's not focus on your lips because your lips look great. Let's focus on things around your lips that can enhance your lips. You know what I mean? Because there's a lot of things that could be lacking around your lips that your eyes are not drawn to them because it's not in the forefront in at the general public, like the chin shadows or like the distance from your nose to your lip, like things like that where people don't think about because they think about just cheeks or lips when it comes to aesthetics. But so much you can do to someone's face that can enhance their natural beauty and not compromising it.
Okay. So, do you think that this is something that can be learned, like the artistic eye? Can that be learned, or you think it's more of a you have it or you don't?
I think it can be learned. Some people learn it faster than others, and some people just have it, right? Uh, it's not something that you automatically know you have.
Mm.
So if like for me, I didn't know, like, not to pat myself on the back, but I didn't know that, I my eyes are so detailed when I look at someone's face. I had to kind of teach myself that and learn along the way. But once you kind of hone in on it, that once that light switches on, it becomes automatic. Like when you look at somebody, your eyes just look at the whole face as a whole, and it never just kind of zone into one area because your whole face, everything complements each other.
Yeah. Okay. That makes sense. Now, I'm sure it's one that you've had some tough cases come in through your door over the years. I'm curious, is there one story that really kind of sticks out in your mind of someone that came in, tough case, and really how you were able to get them a great outcome in the end?
So I have a client who had a birthmark around her lips, and she's had lip filler in the past. So the surgeon removed her birthmark, and so she's got some scarring there. Her lips is a little bit wider on one side compared to where the side that has the scarring, all that stuff. And I'm not working with anything surgical. All I can do is try to, help her feel better and with the skill, with the tools I have and all that stuff. Like I said, she's had lip fillers before. I don't know what their plan was or anything. I don't know if she went in there just seeking lip filler. When she came to see me, I saw the whole scar and all that stuff right away because your eyes are your eyes always go straight to anything that's unattractive, right? On your face, right? You can have the prettiest face, and if you have an ugly mole there, your eyes will always go look at the mole first before you acknowledge your whole face, right? So when she came in, I noticed that right away, and she was like, I want lip fillers. I'm like, you know what? Why don't we can do lip fillers, but let's try to minimize the scars. Like I'm not doing anything to make the scar smaller, but I'm working with her lips to minimize people's eyes going straight to the scar.
Mm, I see.
So yeah, so I was able to shape her lip where the scar looks very like it's not even noticeable. It's
Mm,
still there. Nothing has changed with the scar, but I was able to work with her lips to mask the scar so it doesn't draw anyone's attention to her scar. Does that make sense?
yeah, it does definitely.
Yeah.
Okay, that's fine. That's great. And I think that the story you tell, it's very telling because when people think about aesthetics, I think your average person thinks that, oh, it's just about vanity, it's just about looks. But whenever I ask providers for their most memorable stories, it's almost always somebody that had some type of, for lack of a better word, a deficiency, and they just want to feel normal or they just want to be their best self. And
Mm-hmm.
provide that to them, it completely changes their outlook. It completely changes their life. And
Mm-hmm.
it could be something that's small, but to them, it's the whole world.
Mm-hmm.
So, and I'm curious, like with everything with social media these days, like I'm sure you get people coming in and saying, showing you an Instagram photo that's very heavily doctored or filtered, and they're like,
Mm-hmm.
oh, I want to look just like this, make me like this. How do you approach situations like that when someone comes in, the expectations are just not realistic? Like
Mm-hmm.
you do.
And that's so common, right? So common. And I always tell them, like, you have to take everything you see on social media with a grain of salt, right? You don't know how many treatments this person's had. You don't know exactly what they've done. You don't know if it's filtered. And I always tell them, like, God gave you this face. Why do you want to look like that?
Mm,
You should embrace your own beauty and let's work with what you have,
mm,
right? And that's really what I tell them.
mm,
Like someone that comes with thin lips and they want like, these gorgeous lips on social media. I'm like, God doesn't want you to have those lips. You're the higher being doesn't really want you to have those lips. But let's see what we can do with your lips because I'm not going to stretch your lips to that extent. It won't look right. It might look right on that person, but it's not meant for you.
mm.
Right.
Yeah.
Because my goal is, to restore, to work with what I have, not try to turn you into someone else.
Mm.
Right. We don't want you to be cookie cutter.
Yeah. Well said. So then with social media, do you think, because I mean, it has fueled a lot of the aesthetic industry and the growth of the aesthetic industry. Do you think overall it's been a net positive for the industry or a net negative for the industry?
I feel like it probably more negative than positive.
Mhm.
It puts pressure on women and men to look a certain way. It they are, I don't know how many people are on social media, but sometimes it makes people think that they need to look that way, they need to do this, they need to do that. Like everything is guided on what social media thinks is beautiful,
Mhm.
right?
Yeah.
And in that aspect, I feel like it affects people in a negative way because they may judge themselves and think that because I don't have this, I don't look like that, I need to look like this to be accepted, for people to look at me or appreciate me. Um, I just feel like, in that terms, it is negative. Now, there are positive things about social media, but for the most part, I feel like sometimes social media does cause some stress upon people.
Yeah, definitely. I definitely
Yeah.
understand that part of it. And I'm curious as far as, do you think that this whole trend of people want to look more natural, not wanting to look overdone, like, do you think that that trend will continue and then hopefully try to negate a little bit of the effect that social media has as far as setting those unrealistic expectations?
Well, the trend is definitely going towards a lot of people dissolving fillers and looking, too cheeky or too lippy, right? The trend is definitely going away from that and it's going towards regenerative medicine, preventative medicine, and all that. I think, everybody, they're beautiful in their own ways. Filler has its place, threads have its place, biosteel, they all have its place. You just want to go to someone that you trust. So your idea of beauty aligns with theirs, right? Some people, if they like the the cheeks and stuff, there's always a tasteful way to do it. But for sure, the trend is kind of going away from uh, looking overdone.
Got it. Okay. Now, Thuan, for your own practice, Vital Aesthetics, what is your vision for your practice?
My vision is just to create a safe place for the men and women that come through. We focus on a lot of skincare. We focus on, building up confidence. And so my vision is to be able to provide this to anybody, anywhere. And I tell my clients to move out of state too. If you're unsure about anything, message me. I'm not making any money off of you or anything because obviously you live in a different place. But message me if you feel like people are trying to sell you something you don't need, right? And so I want to create my space, my vision. I'm a small neighborhood med spa. I'm very close with a lot of my clients. They trust me. They come in and they're like, do whatever you need to do. And sometimes it's nothing. Sometimes I'm like, there's nothing I need to do for you, right? If you want to come in and say hi, I appreciate that. So I want to just create a place where, we trust each other and there's no judgment. And I want to be able to have them tell their friends that, there is a place that is not going to be pushing things that you don't need. That's my vision is I like being a small med spa. I know a lot of corporate company buying up med spas and stuff. And you know how it is with corporate, it's all about the numbers and stuff. And my vision is just to kind of keep my place the way it is and be able to provide a service to women without any judgment, without any sales pitch or anything like that.
Sounds like an amazing vision for the practice.
Yeah, thank you.
Okay, well, Thuan, I have one last question for you, but before I ask it, I do want to point people to your website at vitalaestheticnp.com. Now, last question is, what does beauty mean to you?
I feel like beauty is what you want it to be, right? So if you picture yourself as an outgoing, bubbly person, that's beauty. Whether you have big lips or small lips, right? That's beauty because that's who you are. Does that make sense? I know it doesn't have anything to do with what I do, but beauty, and when you come in with that beauty, I can work with that. That tells me what your personality is like and what I have to offer you based on your beauty and your personality. Does that make sense?
It does. It does. Well,
Yeah.
everyone has their own definition. So I think, and your
Yes.
definition is
Yeah.
a good one as well.
Yeah.
Okay. Well, there you have it. Thuan sharing your expertise. So, Thuan, where can people contact you in your practice?
They can just call the front desk or they can send me a DM on Instagram, send us an email. I feel like these days there's just so many channels to reach an office. Most of all that is available at our office. Email, uh, Instagram, TikTok, front desk. Yeah, all that works.
Yeah, awesome. Well, Thuan, this is awesome. Thank you for coming on. Thank you for sharing your knowledge.
Yeah, thanks for having me.
Yeah.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.